there's definitely been a lot of trends that promote the spread of disease. Just globalization itself. Mega cities, another one where just human population are being congested and being a lot more condensed and localized in one area. As our population increase, people begin to live further away from the cities, and then we start to infringe on animal territory, and there's a lot more contact, there's a lot more exposure, hence there's a lot more chances for zoonotic diseases or diseases that's in the animal to be able to cross that species barrier and become human diseases. They're absolutely crucial. A lot of the information coming out of these labs are contributing to modern medical practices. These experiments are extremely crucial to just the advancement of just humanity, and these BSL-4 labs handle the worst of them.
Risk reduction measures are important, and there needs to be an international standard that sort of takes a look at all of these maximum biocontainment labs and tries to at least create some structure for standardization.
The WHO has guidelines on what these labs should have, but there's no international entity that to sort of enforce these rules. Overall, people generally, at least on the international level, people generally don't care unless those labs are built in the backyards.
There certainly isn't enough concern about these labs. There's not a bunch of discussion about the bio research that is happening, especially when we're kind of on the cusp of what lots of people are calling the next biotech revolution. There's going to be a lot of discoveries in the bio domain. And I think that it's likely that COVID-19 will galvanize a lot more international interest in the happenings of biolabs. But before this, there really hasn't been a ton of attention. One of the main takeaways here is that we reconceptualize what biosecurity is and make sure that we're encompassing public health and biosecurity, this understanding of biosecurity that's much more than just the development of bioweapons, and think about biosecurity from a public health perspective as well. So there's kind of this sort of erosion of international cooperation, and even on public health in the middle of a pandemic, right? Which is the time that it's arguably the most necessary. But at the same time, I do think that there is an international sense that something needs to be done to sort of combat future pandemics and to be more prepared.
Gene editing and gain of functions tools, they're great experimental tools for that. We can definitely learn a lot from, but they can also potentially be just as bad. We're at the cusp of this revolution. How we go about it, how we start it is going to be very important, and I think we should be very cautious and take one step at a time.